We're going to be starting the third part. This is number 3 of 4 parts. Third part today. And what we're going to be looking at is treatment and the work you will need to put into treatment. So one thing I want you to keep in mind, treatment for mental illness involves work. If you don't want to work, you get nothing out of it. And you need to put the work in. Just like if you break a bone, you have to wear a cast. Wearing the cast is the work to allow the bone to heal. But if you do not get into counseling and start working on whatever it is that what you need to work on, it will not work for you. This is one of the main points I just want to stipulate, and they'll bring it up in the video, okay? So Dan, would you mind starting the video? Before we start, Dan, let me just have a word of prayer. Father in heaven, we come to part 3 of this series, Lord. We pray for your presence and the Holy Spirit to open our hearts and our minds to understand, to digest, and to incorporate as we deal with other people and seeing through your eyes what people are going through. In Jesus' name we pray. Amen.
Many people remember President John F. Kennedy for his charm and optimism. JFK was born into the prominent Kennedy family of Massachusetts, studied at Harvard, became a decorated military hero, and eventually went his way up the political ladder, defeating Richard Nixon for the presidential seat. One of his wins was the signing of the 1963 Community Mental Health Act, aimed at significantly curtailing institutionalization. On February 6, 1963, Kennedy gave a special message to Congress, stating that he planned to cut by half, within a decade or two, the 600,000 persons now institutionalized for psychological disorders. An ambitious goal, no doubt related to the heavy criticism that asylums or mental hospitals had endured during that era. Yet there was another powerful factor that motivated Kennedy getting involved with mental health institutions: his sister Rosemary. For many years, she had struggled with seizures and mood swings, but despite her episodes of rage and convulsions, Rosemary was a normal, functioning individual. Nevertheless, Rosemary's father felt she was at risk, and in order to protect the family's political future and avoid embarrassment, he authorized for her to have a lobotomy, hoping that it would calm her down. After the surgery, 23-year-old Rosemary was never the same, and spent most of her years in an institution. Lobotomies, first called leucotomies, were invented in 1935 by Egas Moniz, a Portuguese neurosurgeon who went on to receive the Nobel Prize for his discovery. The neurologist Walter Freeman in the United States became the strongest advocate for this procedure. Freeman modified Moniz's technique, renamed the process lobotomy, then performed the first U.S. surgery in 1936. The next 35 years would witness more than 50,000 lobotomies conducted in the U.S., many at the hand of Dr. Freeman. It was Freeman's partner, neurosurgeon James Watts, who conducted the lobotomy on Rosemary Kennedy. In the beginning, Freeman's procedure severed the connection between the frontal lobe and the thalamus. But nearly 10 years later, based on the work of Amado Fiamberti, Freeman developed the transorbital method. In this procedure, electroshock rendered the patient unconscious. Then Dr. Freeman would place an ice pick above the eyeball and hammer it through the orbital plate. Moving the pick around, he'd sever parts of the prefrontal cortex. He would then repeat the action on the other orbit as well. Honestly, Freeman's method are more akin to mutilation than neurosurgery. He lost his medical license in 1967, but by then he had personally conducted an estimated 4,000 lobotomies. 2,500 of those utilized the ice pick method. But we're talking about fairly recent history here. Let me step back into antiquity a minute, because the puncturing of the skull as a treatment for mental illness began way in the distant past. During the early history of man, mental illnesses were seen as spiritual issues, where evil spirits were trapped within the head. The method for treatment was called trepanation. This is where a hole would be drilled or scraped in the skull to allow the evil spirits to escape. Now, I'm not discounting or downplaying the existence of evil spirits in this world. I believe that supernatural and satanic forces are very real. But over the years, there have also been many atrocities perpetrated in the name of religion. Mistaking mental illness for a type of demon possession has only led to maltreatment and injustice. Around 500 BC, physicians began to suggest that mental illness was not a spiritual issue, but a brain-related problem. The big question was, what was causing this occurrence in the brain? It was speculated that the cause could be related to body fluids called the four humors. Thus, those who practiced medicine turned to bloodletting and purging, a form of cleaning out, emptying the bowels. While these treatments had many negative results, one positive treatment did emerge from this era, talk therapy, and has played a significant role in the healing of many patients. During the Middle Ages, approximately 500 AD to 1500 AD, the connection between spiritualism and mental health made a resurgence. Both men and women, but primarily women, were thought to be demon-possessed, and witches. Exorcism, blistering, and even burning at the stake or hanging were typical treatments during that era. From the late 18th and 19th century, the Industrial Revolution ushered a materialistic form of thinking. With a heavy focus on capitalism, the value of an individual was determined by their ability to work. Prior to the 18th century, it was normal for mentally ill people to be taken care of by their families. But now, families were able to avoid shame and burden by putting their relatives away. The conditions for these loved ones weren't very loving. Mistreatment and abuse were prevalent. It is these factors that gave asylums a bad name and led to the eventual reformation of asylums and a push for moral and humane treatment for the mentally ill. One of the U.S. reformers was a man named Benjamin Rush, the father of American psychiatry, as some have referred to him. Rush promoted a healthier, more humane treatment of the mentally ill in institutions and lobbied for improved conditions. Notwithstanding, Rush continued to use a myriad of unconventional methods in his treatment arsenal, such as bleeding, blistering, cupping, and the poisons mercury, arsenic, and strychnine to induce vomiting and diarrhea, and would follow that up with cold baths and exercise. It is said that Abraham Lincoln's doctor, Anson Henry, used Rush's methods to treat Lincoln's depression. Lincoln would later confess that after spending a week with Henry, he, Lincoln, was the most miserable man alive. Scientific studies took a turn in the late 18th and 19th centuries as genetics began to play a role in mental illness prevention. Scientists postulated that the quality of the human population could be biologically improved by eliminating poor genetics and heredity. This idea became known as eugenics. Eugenists promoted methods such as selective breeding, involuntary sterilization, and social exclusion in order to rid society of individuals deemed unfit. Among the many who found themselves targets of the eugenics movement were the mentally ill. Laws were passed in 30 states making it illegal to force sterilization on individuals deemed feeble-minded or antisocial, which resulted in the involuntary sterilization of at least 60,000 people in the U.S. by the 1970s. The 20th century gave us an Austrian neurologist named Sigmund Freud. With the science available back then, unable to fully explain what was occurring in the brain, and especially why, Freud developed theories about human psyche using various methods to include hypnosis. Psychiatrists such as Roy Brinker latched onto this idea of hypnosis and began to use sodium pentothal in order to place soldiers in a semi-conscious state, allowing them to relive their trauma and tell their story to get it off their shoulders. Freud demonstrated that the power of talking and making observations about one's inner life could improve symptoms of mental illness. The 20th century also introduced more radical treatments. These included electroshock therapy, ice therapy, insulin shock to induce seizures, insulin comas to purposely induce low blood sugar, and fever induction through infecting patients with bacteria such as tuberculosis and malaria. And of course, there were the dreaded lobotomies. Now, before we are too hard on our ancestors, I do have to point out that in many cases, the thinking was reasonable, but the prescription and execution of treatments lacked scientific support. In the case of trepanation, we successfully use a form of that today. Studying the four humors led to some crazy treatments. But today we know the importance of the bloodstream, and many diseases can be determined through the testing of body fluids. Electroshock therapy has been refined and proven to be effective. Even lobotomies, while no longer administered in such a careless and violent manner, have evolved into precise brain surgeries. The fact is that in many of our past treatments, we find the birth of our modern methods. And while we can never condone the inhumane procedures of the past, we can't deny that in some way, our more refined modern systems are indebted to the road they paved.
Treatment for psychiatric conditions today fall into four main categories. There's what we call psychotherapy or talk therapy, training therapies, which involve training behavior or cognition, how we think, psychopharmacology or drug treatments, and then there are what we call device therapies, where some type of instrument is used to provide some type of stimulus to the brain in order to affect brain function. And a great area of interest in research today is patient stratification, and that's a fancy term for saying what treatment is most likely to work best with this particular individual.
One of the first things that really got me thinking about seeking help and treatment was when my wife had mentioned my son was manifesting secondary PTSD issues. Even after I started seeking treatment, was doing aggressive counseling, had been on medication for a short while, and was involved in some other peer-to-peer work. A lot of people are just uncertain about what to do, but it was kind of the blind leading the blind.
We're not treating diagnoses, we're helping people. And so what we want to do is to be able to say, how do we best understand this person's particular challenges, the alterations in the brain that might be affecting this person's mood or behavior. Cervical cancer and head and throat cancer, same cause. Till a couple years ago, those are about the most different kinds of cancers that you can have, and that's just the same cause. Psychiatry is in a very important transition stage now. Many of the currently available treatments that we have, particularly drug and device-based treatments, are the product of serendipity. An astute clinician noticed that a drug developed for a different purpose or a treatment that a patient had for a medical problem improved their clinical condition. And so then pursued that, a set of studies to figure out how best to use that. But it was with the knowledge that it helped, but not with the knowledge of how it helped. What we are seeking in much research today in psychiatry is to develop new treatments that are actually based upon understanding the underlying mechanism of disease. process that we're either trying to correct, or one of the amazing things about the human brain is that it is highly plastic. It's very changeable, and it has this intrinsic drive to restore what we call homeostasis, or normal balance.
When I started the journey, I thought the healing process would mean basically like I eradicate the anxious parts of me. Like somehow they get healed and they leave and it's not something I have to deal with. And what I've found is it's actually more welcoming those parts of me, whether it's, an actual mental illness and disorder, or maybe a season where it's just heightened because of circumstances. It's the same experience in the body. It's that sense of being in a heightened state of fight, flight, or freeze, which again is a natural way of responding to threat. It's just you happen to be on overdrive. So that's when I would say, like, my senior year of college is when I had my first, I am aware that I suffer from anxiety. Therapy actually became a context for me to do a lot of work of, this didn't happen in a vacuum. Like, I didn't develop an anxiety disorder because it's just like my personality, or, it's just like who I am. This was a way my body responded to the environment I was in order to survive.
There are always root causes, and I say causes because I don't think I've ever seen anyone struggle with a significant mental health problem where it's just one issue. It needs to be something that we're working on constantly. It's not just like, okay, now I feel better, and so therefore my mental health is fine. No, when I think about mental health, I'm like, this is something I need to work on every day, because I want to become the best version of myself. I want to, yes, experience peace and joy today, but I also want to continue to grow. Oftentimes when we're struggling with pain, our reflex reaction, just like if we're touching a hot stove, is to jerk back, right? None of us like pain. And so we're going to avoid it, and that's normal, but it's not always healthy.
There's a difference between wanting the pain to stop and wanting to really be healed. In the past, when I was really struggling, I was identifying with my issues, allowing them to define me. I learned very early on how to see people through a very objective lens. They were there to meet needs. They were there to exert power over, or whatever, because that's how I was treated. Just really being able to look at a person and see them as a person was really huge for me. Continue to push on to a point where you're flourishing, and not only flourishing yourself, but helping others flourish.
It's so important that we understand we all have weaknesses. We're all human beings that are broken in one way or another. And we need to, just stop pretending like we're totally fine, and that if we just keep ignoring these issues and pretend like everything is fine, put a smile on my face, that they're going to somehow go away. Oftentimes, one of the big things that they're struggling with is a lack of hope. Like, I don't know where I'm going to go with this. I don't know how I'm going to get better. Is there even hope for me? Helping people to realize that they can get better. Helping people to realize that they're not alone. That does wonders for people. You don't have to get it together first.
It might be one of the 4 forms of treatment that we talked about. Psychotherapy, device therapy, medications, or training. But there's tremendous help to be provided just through human relationships. To be able to recognize when someone might be at risk of harming themselves or others, and making sure they get the help. Be willing to go with them, to help them make the call, to make the appointment.
It's exciting to see the development of treatments over the years. From those rudimentary and crude methods of the past, society has been able to carve out the modern techniques that bring health and healing every day. And the most thrilling part is that we're not done yet. In fact, we are on the verge of some incredible breakthroughs. Never before have mental health professionals had the tools available to them to more properly diagnose and treat mental illnesses than they do today. Some of these new techniques are only in their infancy and yet are already producing fantastic results, which means we may be looking at a bright future for the betterment of mental health practices. So let's take a look at some of those cutting-edge processes.
One of the important areas in psychiatry today is the study of the nature of brain alterations in a variety of psychiatric diagnoses. We need to make sure that our diagnostic categories actually have biological validity in terms of what's wrong with the brain. There have been tremendous advances in our capacity to visualize a living human brain, to be able to visualize its structure with increasingly fine detail, and to be able to visualize how its activity changes in the context of doing a variety of tasks and even thinking of certain things. We have a number of new medications that target specific brain circuits or molecules in the brain that are very promising. We have a number of different ways of what we call neuromodulation, of providing some type of external stimulus to the brain, whether it's in the form of a low-intensity electric current or magnetic current, or even ultrasound to change the function of circuits. We have new tools in terms of cognitive therapy to help people manage their thinking so that they in turn manage their emotions better. I'll give you one example from work being done here by Dr. Rebecca Price, and it is based on the discovery in the last half dozen years that a single dose of a drug called ketamine can give a rapid relief of depressive symptoms. What she's showing is that if you combine a single dose of ketamine with a form of cognitive training that retrains the brain to associate positive feelings with the self, that the antidepressant effects of ketamine can be sustained for months. We actually developed techniques where we can record electrical signals from the living human brain, convert those through computer algorithms into tools that can move devices. So people who are paralyzed, who by having their brain recorded while they're thinking of moving their arm, that signal can actually be transduced into a prosthetic arm to make it move. So it's just fascinating and staggering how our understanding of the human brain continues to grow. But it's one thing to say that we know how the sensory motor system works, and it's another thing to say that we understand how thought and feeling work in the brain. We're still in an early phase, and we're actually not even sure how early a phase we're at in terms of actually being able to visualize, record, quantify the brain functions that go into our deepest abilities to think and feel and reason and make judgments.
The history of mental illness treatments demonstrates a tension between the acknowledgement of the abnormal and the mystery of human function. The fact is that humans are extraordinarily complex, and despite our modern advances, we still struggle to understand the how and whys of the way we work. At times, and especially for our ancestors, the best we could do is simply compare people to our accepted societal norms, and if they didn't fit, declare that they were not normal. Early on, at least in the case of those that didn't pose a threat to themselves or others, society was content to provide as much freedom to the mentally ill as possible, most being cared for by their families. Capitalism and industrialization brought this to an end, in that now the value of man was more linked to their wallets than anything else. Those who could not produce were viewed as undesirables. This new movement brought the need for institutions where the mentally ill could be locked away for the benefit of themselves, their families, and society as a whole. The early asylums were crude and inhumane. gave institutionalization and mental illness a bad rap. However, over time, much needed reform took place, and the asylums of old slowly transformed into the professional mental hospitals we know today. Now, while we lament the way the mentally ill were treated in the past history, especially those that were institutionalized, scholars tell us that the birth of mental illness coincided with the institutions. You see, before this, mental illness was just scattered incidents around the globe. There was no way to determine the extent of mental illness, no concerted effort to study behavior in the mind, and no processes to test and develop treatments. Institutions, because they brought numerous mentally ill people together in one place, brought attention to the grand scope of the problem and provided a location where observation and research could evolve knowledge and treatments, giving us what we have today. While we're not there yet, and continued research and development is needed in all fields of mental health, great strides have been taken since the days of old. Today, many solid options exist for the mentally ill that, for many, can provide lifelong relief for the issues that torture them and the ones they love. While many of the treatments of our forefathers were misplaced or incorrect, in truth, they did the best they could with the knowledge they had. Honestly, I marvel at how much they got right, including their linking between spiritual forces and mental health. Remember trepanation, the practice of boring into the skull in order to free the evil spirits, which some say goes back as far as 6,000 plus years ago. And then there was the revival and fixation of spiritual causes in the Middle Ages, where it was believed that the mentally ill were possessed, or even witches, leading to exorcisms and prayer rituals and even executions. Well, like the other methods that were rooted in some truth, but executed poorly, it appears that there's something to this spiritual element as related to mental illness, just not quite like our ancestors believed. You see, the ancients, up to our forefathers, emphasized the spiritual realm as responsible for the mentally ill, specifically that people were possessed by evil spirits. They were fixated on this and naturally conjured up ways to cast the demons out, isolate the ill, and even dispose of the possessed. But what if they were simply looking at the wrong thing? What if they had become so tunnel visioned that they misplaced causation, leading to an incorrect diagnosis, which in turn produced the wrong treatment? It turns out that spiritual treatments, when coupled with the more traditional scientific and new technological breakthroughs, are actually a powerful tool towards mental fitness and the healing of mental illness. Join me next time for Binding Up the Broken Heart, the link between your spiritual and mental health. Until then, God bless.
I think it is. I think actually I had a brand new slide in when I was setting that over. Okay. Welcome back, everybody. This is the third one, and this is the episode on treatment. I am a big proponent to treatment. I work in the field, of course. But we do know that when a person comes into treatment, they do the work, we see the best outcomes. What role does guilt play in our actions and decisions as human beings? Thoughts? What role does guilt play in our actions, decisions as human beings? Guilt about what?
Guilt, shame, and blame.
I had a professor in college that says that the shoulda, woulda, couldas, guilt, shame, blame, sit right here. Shoulda, coulda, woulda, guilt, shame, blame, all same thing. Sits right here on our shoulders. And if we don't deal with it, it's going to overcome us. And it's not guilt. there is a correct guilt, but then there is an disproportionate incorrect guilt. Tell me what kind of guilt you might have as a human being with mental illness.
I wish I'd never done that. I don't know.
Sure. The gentleman that had PTSD or trauma, did you hear the guilt he was talking about? I was doing this to my family and they were just living with me. Then he found out I'm in treatment now. His son has secondary PTSD type symptoms that he learned from dad. This is a vicarious diagnosis at this point. And he's probably guilty about that. What did I do? The one thing that I will tell you right now, if you say, I should have, could have, would have, stop the talk. Especially if it's in the past. Because you will keep repeating that message to yourself over and over, and it's going to create a problem with the understanding of who you are and depression, anxiety. And the reason I say that is because I've done that to myself. We just cannot play that record over and over and not think we're going to escape the effects of it. In today's society, there's a strong push to treat mental illness just as seriously and humanely as physical illness. Do you think that this focus on mental health is due to more increased awareness of issues at hand, or more guilt and a deep urge to atone for the many atrocities of the past treatment? Does the exact motivation behind the change really matter? What you heard was, we're trying to get past what we did. We're trying to get past what was in the past and move forward with new information, new technology, new understandings. This is asking deep urge to atone for many. I think there may be a part of that. Does the exact motivation behind the change really matter? Yes and no. And I have somebody shaking their head no. As long as we're moving forward in treatment and we're using the latest understanding of technology and therapeutic modalities, let's keep moving forward. They're effective, they're working, and they're not hurting anybody. Some of the stuff that he talked about, and I actually, since my family comes from Portugal, and I hear a Portuguese doctor doing lobotomies, I'm like, oh no. No, we didn't do this. But we did. And what we learned from lobotomies gave us an understanding of what you should and should not do with the brain. Severing the frontal lobe from the rest of the brain, especially the hypothalamus, it doesn't work. Yeah, it takes care of the symptomology, but you have a quote-unquote zombie on your hands because they don't make any more connections. Our frontal lobe is a very important emotional thinking tool. So, moving forward, learning what we've learned, trying to stay away from the past and what we did, yeah, I think we're trying to get past some atrocities and use more humane technology in treatment.
I also heard them say that they built upon the knowledge that they gained from that, and I thought I heard them say that we wouldn't be where we were with our brain surgery technology without some of that. So
This is true.
I don't think we can
What
discount
was
the
it called?
knowledge that we gained.
Let me grab a... Larry makes a good point, and this is true. We would not be...
So what I was saying was that although what happened was unfortunate, that the knowledge that we gained from those antiquated procedure of the lobotomy, we did gain some good procedures for current brain surgeries from it. So we built upon that. So I don't think we can discount it. It's not that it's valid now, but then the information we got from it is valid now.
Right. But are we making an atonement for it? I think kind of. I think it's not that important that we should be making an atonement. I think we need to say we won't repeat it because we know different now. Let's move forward on a different path.
Thank you.
John 11:49-50, and one of them, Caiaphas, being high priest of the year, said to him, "You know nothing at all, nor do you consider that it is expedient for one of us that one man should die for the people, and not the whole nation should perish."
You should have the lobotomy, but not me.
Yeah. Mm-hmm. In what way does the concept, the greater good, sometimes lead us to unthinkable things? So we're looking at, we're looking at Kennedy's family. They put the sister away because it was for the political future.
I think sometimes in families you will see that one individual has a lot of challenges or they're acting out a lot, and everybody points to that member of the family as the one who they have problems, but yet the whole family needs to learn how to relate better to each other, how to support each other better, how to avoid patterns of relating that might be playing into that person's problems.
And this has been portrayed in different media, especially movies from in the past, where you have that silly, crazy aunt, and they just put her in the back room, and that's just who she was, but she doesn't come out and socialize. This has been kind of the way families have lived because mental illness was not understood.
Makes me think about how governments and medical facilities around the world, not just us, have experimented on populations of different kinds for their own progress in the field. Like populations that can't control whether they say yes or no, they want to be a part of that experiment.
Yeah. Forced experimentation, just to get to the end of what we're going to learn in this experimentation. Mark 5:1-5. Then they came to the other side of the sea, to the country of the Gadarenes, and when Jesus had come out of the boat, immediately there met him out of the tomb a man with an unclean spirit, who had his dwelling among the tombs, and no one could bind him, not even in chains, because he had often been bound with shackles and chains. And the chains had been pulled apart by him, and the shackles broken in pieces. Neither could anyone tame him. And always, night and day, he was in the mountains and in the tombs, crying out and cutting himself with stones. Okay, let's go back. While not discounting the reality of the spiritual forces at play in the world today, what dangers lie in assuming that an individual is demon-possessed and not mentally ill? Can anybody think of the dangers of having those two mixed up?
Not getting the medical assistance with medication if they need it medically.
I can think of stories of people who were more likely mentally ill and people of the cloth trying to do demon possession exorcisms and not being successful because it's actually a mental illness, not a demon possession. You can see, talking about a person that we noticed in town yesterday, standing there screaming at the top of his lung, clearly psychotic, because I do understand who this person is, clearly psychotic, screaming at the top of his lungs, kicking things, scaring people. Is it demon possession, or is he psychotic, off his meds, and also on methamphetamines? And you could say that he looked like he was possessed, but he wasn't. It was a mental illness. And I think sometimes we have to be careful, and we have to really have an understanding between the difference between mental illness and spiritual possession.
So you can be spiritually possessed and be mentally ill.
Mm-hmm.
But you could be mentally ill and not necessarily spiritually possessed.
Yeah.
And I think it's an important thing. I've dealt with absolute demon possession things where the bed is coming up off the ground and there are things going on that you don't even tell people because they'll think you're nuts.
Sure.
You know, I think that's what they called, what's that first word we had in that night?
Stigma.
Oh, stigma, yeah. I think it has to do with stigma.
Yeah.
And then I have dealt with a lot of people who are mentally ill. And the two, if you're kind of in that field, you kind of understand what the difference is. If you're not in that field, don't mess with it.
Well, I will say that I have not encountered that I know of demon possession. I do know that there's significant differences between the two. What I will also tell you is that demon possession doesn't have to go to that extreme.
Oh, sure.
You can be tempted, and that temptation is a type of, I mean, if I'm doing something I'm not supposed to be doing and it's against God, and I'm following what Satan's wanting me to do, and it's a behavior that is definitely unbecoming of God, am I possessed? I am following something I'm not supposed to be. It's a question. It's just a question to think about, whether it's true or not, and how you feel about those kind of things is on you. But it's always something that I've played with in my head, that if I'm not doing what God tells me, and I'm doing something, especially in the lifestyle that I lived in, and I'm touching into that again, is that of God or is that of Satan? And who's leading me on that path? Just a thought. Just a thought.
It also goes the other way too. People who are suffering with mental illness and maybe are psychotic, having maybe hallucinations where they can see things that we don't really see or hear things that we don't really hear. We have to listen to them very closely because sometimes they have medical issues and they're telling us, but we're not hearing them. And I've experienced that. And it's very common with people who experience those to have like UTIs, and that will make their symptoms worse. And sometimes they will be complaining about things, and not people think that they are talking about their symptoms, when in reality they have had a medical issue.
Yeah.
So we do have to listen to their words and act upon them when we think that maybe they need to see the doctor, and not just think that they're talking about their psychotic symptoms.
Yeah. Mm-hmm. She brings up a good point because I can think of a patient who, if they didn't have somebody to advocate, the doctor would say they're making no nonsense. Meanwhile, they're actually having a cardiac problem. Mm-hmm. And the person working with this individual understood what they were saying, even through all the gibberish. Say, his chest hurts. It's been hurting. There's a problem, and they found out he was having cardiac problems. He just didn't know how to express it. Well, let's see. Why are solutions such, I wanted to bring up something before we hit there, because we were just talking about way back in the day when I worked for one of the crisis teams in Northern California. We had a woman who was psychotic, but it wasn't the scary type of psychosis, what you would say is some people are talking to me in my head, stuff like that. She was happy because her psychosis was hearing angels sing to her, and she could see the angels. She was totally content with that lifestyle. We medicated her, took away the angels, because of course the psychiatrist said, no such thing. She decompensated once we got her on meds. We took her off the meds, she stabled out, got back with hearing the angels, seeing the angels, and she was never a problem. You know, this has got to be a case-by-case basis. And who's to say that she really is not seeing angels and hearing them? I would say that it's more likely it's psychosis. But at the same time, when we can medicate for something and it disappears, it's more psychosis. But why are we touching something that's not harming somebody?
Quality of life.
Quality of life.
That's right.
Yeah. Why are solutions such as pray more, study the Bible more, go to church more, etc., not always the best remedy for mental illness?
Possibly because I'd say possibly because those all are solutions to getting to know more about God and not have a personal relationship with Him. Because knowing about God is not going to fix your mental issues, but a personal relationship with Him will allow Him to do the healing in your brain that you desperately need.
Yeah. And I think we also want to.
I think from my standpoint, as an old pastor, as an old alcoholic, as an old drug addict, as an old person who was on the other side of the fence for a very long time, to my way of thinking, this is the best start, but that is not the whole remedy.
Right.
And so I think sometimes we think that it is the whole remedy, but it is, to me, the best start. It's where I got my start to come out of the pit of hell that I was in.
Right.
But it took, like you said yesterday and today both, it's a lot of hard work. And if you've got God as your partner, the work is a lot easier.
Right. So this is something that's going to be talked about in the next film. And I will allude to it only in the fact that he made the comment about spiritual coupled with therapy, we find the best outcomes in treatment. But it is a collaboration of therapy and your spiritual walk.
I think sometimes it's put out sort of like pull yourself up by your own bootstraps.
Yeah.
It's just a very superficial thing, and it's a judgment.
Right.
A lot of people feel it as a judgment. Well, I am praying, you know.
Yeah.
Why isn't it working? And it's not the only thing.
Well, one of the people they were interviewing, the female, she even said, I might as well just forget about that. I'm praying, I'm doing everything I can, but now spiritually I'm starting to doubt God. This is the start. And let me back up. God has made us all smart individuals. Some people make poor decisions, but He's put therapists on the planet, He's put medical doctors on the planet, He's put lawyers on the planet, pastors. All these individuals work on keeping somebody healthy and stable. They can. Doesn't mean that they always do. Coupled with spirituality and therapy, we do find that there are good incomes. And we're going to talk about what the American Psychiatric Association found out about that back in around 2003. That's tomorrow, though. Oh, this thing's going to need the batteries. And I heard a loud voice from heaven saying, Behold, the tabernacle of God is with men, and He will dwell with them, and they shall be His people. Revelation 21, 2 and 3. And God Himself will be with them, and they will be their God. Until now you have asked nothing in my name. Ask, you will receive, that your joy may be full. Behold, I stand at the door and knock. If anyone hears my voice and opens the door, I will come into him and dine with him, and him with me. Revelation 3:20. While many bizarre treatments for mental afflictions were tried in ancient days, one treatment that proved effective and is still used today is talk therapy. Again, I'm a proponent of going in and talking to somebody what bothers you. If they're good, they will help guide you through whatever it is. A good Christian counselor will work in tandem with your spirituality and whatever your mental illness is. Sometimes those are hard to find, but again, tomorrow we'll discuss a little bit more about the mandate that we as clinicians have during our intakes to find out about what people's spirituality is. In what ways is communication a powerful healer for us? Does anybody know what empathy is? Okay. Empathy is a powerful tool if you're working with somebody. You may not know exactly how they feel, but you can imagine what that might feel like if you went through it. Empathy can be a powerful tool when we use it to make a connection with somebody, to understand where they're at and help them grow. What changes results from industrializing capitalism have negatively affected our society and mentally ill specifically?
Was
That
from January this year, or was that forever?
we can go back in time, because even when I lived in Los Angeles, I felt like I was just a number.
Yeah, the value of human worth.
The value of human worth was exactly what I experienced, because I just felt like a number in a sea of people. And we cannot put the value of somebody and their health, we cannot measure it in money. One thing that Medicaid did, and this came from the federal government down to the block grant to the states, was they opened the door of what mental illnesses could be treated and billed for. We have a book called the DSM-5-TR that's 1,000 some odd pages with diagnoses in it. And they opened the door to almost every diagnosis in that book that we could treat in a clinic. Some of those diagnoses have to be treated by a medical doctor. Some of those diagnoses need to be treated in conjunction with a psychiatrist. And therapists can only diagnose certain diagnoses when, depending on what state you're in, I cannot diagnose autism. I cannot intellectual disability. I'm not a medical doctor in this state. I cannot diagnose it. I can secondary as a rule out, and I have to have a medical profession validate that. But in California, I could do that because I was trained to do that. But it comes down to dollars and cents. When we opened up the door for Medicaid clients to receive services, anybody on Medicaid was free to come in and sign up to get help. It's them wanting to come in and get help.
I think the forced sterilization has had an impact on that too.
The forced sterilization, how so?
I'm not quite sure how to verbalize it, but that's what my brain says. So I know that I had my mother's cousin was a forceps baby, and so she was unaware that she was pregnant and unaware that she delivered. And after several children, although she was married and had a family that could help, the state took the children away and forced sterilization. And we're talking in modern times. So that's a way that industrialization and capitalism negatively impacted, because if we were to look 100 years ago, that family would have been able to keep those children because it was not genetic. So the children were fine.
That also comes down to not just industrialism, capitalization. It's we don't want to perpetuate. We have to have a functioning society that's part of this.
Yeah, I can remember as a special education administrator, I was telling the students this past week or so, because, the Bible says, and as much as you've done unto the least of these, my brethren, you've done unto me. And so back in like, I think it was probably about 1978 when I first started in administration, It was the beginning of, you know, it was after 94, 142, and IEPs coming in for kids, children with special needs. And so then all of a sudden out of the institutions come severely and profoundly mentally handicapped individuals into the public schools. And of course the public schools did not want any part of this because of that issue, because they said they cannot contribute to our society and the industrialization, and how are they going to be tax-paying citizens and so forth. And I wasn't a Christian at the time, but the Lord gave me the wisdom to say they're probably the most valuable members of our society, because we have an opportunity to serve where we don't necessarily look for a return on our investment. And that's the biggest return.
Yeah.
And so the whole emptying of the institutions for cognitive impairment came about, where individuals were able to return to live with their families regardless of the fact that they had a mental disability. I mean, young people, they were forced to leave their families because of mental retardation. And to have that come back and then be returned to the families and to the schools, people didn't like it, and they felt like it was a detriment to our society because of economic reasons.
Yeah. There was a gentleman who had Down syndrome. He was an actor back in the 90s. He was on a family television show and he had Down syndrome. Meanwhile, he's an actor in this program. You're seeing a story of two other people who have Down syndrome want to get married and have children, and the state is stopping it. Because you can't take care of children, you don't know what it means to take care of children, and we're going to have to step in all the time. Government's going to have to deal with this. So they were trying to force these two not to get married and have children. Meanwhile, you have, look at this, a Down syndrome gentleman is an actor. How wonderful, let's praise it. It's a completely opposite way of thinking.
I think the elderly too.
Yes, I actually have a friend of mine. He is 68 now. He says, I'm giving up trying to find a job. Ageism, he's in Minneapolis. He says, ageism is everywhere. I can't find a job anywhere because I'm too old.
How old was
He just told me this about 3 weeks ago. He's 68.
Well, I'm 88. He can come home my lawn.
Okay. Is that what you think of people? Come on my lawn.
We need to recruit him over at Mission Creek for all the rest of us 68-year-olds.
Yeah. What can we do as a society to promote freedom, advancement, and prosperity while not sacrificing compassion, our duty to each other?
Just be compassionate.
Just be compassionate.
We don't have to sacrifice our compassion. We just have to be compassionate.
I think that's the big pull away here, is just be compassionate. Question? Is just being compassionate. We don't have to sacrifice anything. Compassion can go along with it. We can rise above with compassion where freedom, advancement, and prosperity are.
Sometimes we have to be very careful in our compassion.
Yeah.
Well, there is codependency. There is stepping in and forcing our will on somebody. There is also you don't know it all.
No.
You don't know it all. And that's one of the problems with compassion. We think we're being compassionate and we're not. What dangers are there in projecting someone's potential future actions and illness through modern methods such as scans, or even today's hot button topic, artificial intelligence? Okay, so right now there is research being done to look for genetic markers for mental illness and other diseases. And even though it's not a perfect science yet, they're still working on it, and they can weed out some of this stuff through genetics. I'm concerned about that. I am concerned about that thinking.
So we have this in insurance today where people with certain pre-existing conditions aren't able to get care that they need because at one point in time they had some sort of condition that's now considered too expensive to treat them. And so I think the danger that you have here is that you can have somebody and they did some sort of scan or diagnostic and they say, well, this person is going to become violent and going to become, criminal or going to be a drain on society's resources, and then that person is not able to access jobs and access, the things that they need like anyone else could.
Mm-hmm.
And none of these tools are perfect.
No. An example of an imperfect tool, men's anger was looked at in criminal behavior some 20 years ago, and they kept saying it was a genetic component in the DNA of males that they're prone to violence, they're prone to the antisocial behavior, but that weeded out is not true. After further looking at DNA, and as DNA science grew, we're not coded for anger. And anger is not an emotion. It's a combination of emotions is where anger comes from. So it's kind of interesting that for the longest time they had this misnomer that men are coded for these tendencies, and it wasn't true. The other thing is artificial intelligence. I was just reading a news article 2 days ago, it was this last week. There's 2, if not 3 lawsuits right now because kids have suicided due to artificial intelligence.
Yeah.
These kids have isolated, they made friends with the artificial intelligence. There was, the families are suing because the artificial intelligence started sexually grooming the children and talked about how to suicide. Now, one thing about artificial intelligence, and this was also talked about, where did the artificial intelligence pick up the ideas to have these conversations? Had it been from the kid? Or something that was on the computer that the computer picked up? You all know your phones are listening, right?
Yeah.
Don't think artificial intelligence is probably not listening also to conversations in the room. But I will tell you, the kids suicided because artificial intelligence went ahead and urged them how to suicide. And there's 2, if not 3 lawsuits right now going on in the United States over this matter. And it's from the families who lost the kids.
Yesterday, I went to the chiropractor to get an appointment, and I was just talking with the receptionist about, she was telling me when I could have that appointment, and I opened my calendar. When I went to my calendar, the thing was already there, 3 o'clock on Friday.
Mm-hmm.
It put it in my calendar, and I hadn't put it in there, and there was obviously something hearing the artificial intelligence, like it's hearing that communication and documenting.
You can have your phone sitting over there. Talk about wanting, we need to mow the lawn. And maybe you need to look into a new lawnmower because this one's getting a little hokey. And every ad I see is a lawnmower.
Yes.
Yeah. Okay.
Excuse me.
Yes.
Oh, well, no, I was just saying that a lot of times AI, sort of my experience, is it tells you what you want here.
Yeah.
Like you can kind of tell what you're getting at, and it will agree with you.
Yes.
Because I think it's been programmed to be agreeable and not be computational.
Yes.
And a lot of it, since I can't speak for every AI that's existed, but
Right. This was ChatGPT that was the problem.
right,
This was, and like I said, how much did the kids feed into it?
right. So what it said to the children probably had a lot to do with what they said to it.
But then again, it comes down to a problem of that kids are relying on ChatGPT for friendship, and then when they start talking about, believe me, they start talking about to their friend about feeling suicide, GPT says, yes, and this is how it might be done. This becomes a problem. So your friend that's agreeable with you is now saying, hey, that's a good idea.
Well, and the issue is that it can be programmed to where if that subject comes up, it diverts, and it hasn't been.
And it hasn't been diverting,
And
no.
that's what they're saying.
The other thing that is social media. We have in kids department in particular, we do see it in some of the adult department. We can be in, our mental health is influenced from social media. We have more kids walking in, and this comes in cycles, that they have dissociative identity disorder. That's multiple personalities. Well, TikTok says if I do this, this, and this, then I must have a multiple personality.
Yeah.
Then you had, before that, we had this slew of bipolar disorder coming through the door. Everyone was saying they were bipolar. Now the new trend is something else, and I was talking to the kids manager about this, and he goes, oh yeah, we've got a problem. They're not coming in saying they're this. It's like, no, they're not. They're not displaying any of those symptoms. TikTok says they are.
Yeah.
So we've got uphill battles in mental health because of some of these new technologies. And scans can be helpful. When I was young, I was about 6, I had an EEG done, and at the time, they had to measure because I couldn't go to school. I was getting such severe migraines, they would not send me to school. I couldn't be sent to school. They thought I had a brain tumor. At the time they were using needles. They're more refined now for a pad, and they can look a little deeper into what was causing my migraines. But I had to go from there, and then it had to be read in San Francisco. And they told my mom, he's got the same thing you have. Mom says, I knew that. I don't know why we're here. But technology has gotten so far along that now I could have that scan again. We can actually see what the cause of my migraines are when I do have them, which is not very often. I grew out of them for the most part. Okay. Next, binding up the brokenhearted. This will be our presentation for tomorrow. This is not just looking at treatment, but compassion and treatment. Spiritual, yeah, it's combining the spiritual with treatment and compassion. So we will do this tomorrow. 1 o'clock is the luncheon, the cooking school with the lunch, and then 4 o'clock will be our last training. Do we have any questions at this time? I want to thank you all for the long day. I want to thank you all for staying today, and I hope you've got something out of this today.
We've been having a little chat here on this beach. Now, these two guys are saying this AI thing, what are y'all saying that it isn't? ChatGPT, that doesn't happen with ChatGPT?
Yeah, it's
They say it's a violation of what? The content
The
policy.
problem is, yeah, but the problem is, their content policy has not been upheld. This is why there's lawsuits out against them. Yeah, there's content policy, and then do you uphold your content policy? Because they have these teenage kids on there doing this.
And that's, but so because the content policy was not upheld, that's why they have
So,
lawsuits.
Facebook also said they had, during political elections, Facebook says we have content policy that we don't do this, but it was still happening.
Right.
And that's where the problem is when it's still happening and content policy is not being followed. Okay. Again, I want to thank everyone for coming in, and I wish everybody let's have a word of prayer as we depart for the day. Father in heaven, I want to thank you for being with us today, for helping us educate around mental illness and working with people, Lord, as we leave today. Be with our hearts and keep us safe as we travel. Bring us all back tomorrow and urge us to every day look at everybody with your eyes. In Jesus' name we pray. Amen.
Thank you.